one second for me. Okay. Yes, we will be sharing the results from the chat link later on in our town hall. So to explain more about UIHI and our mission and our goal for today's town hall, I'm going to go ahead and hand off to Dr. Rosalina James to go ahead and give that explanation for us.
Hello, everyone. My name's Rose James, and I'll introduce myself or be introduced a little bit later, but I am the Director for Evaluation and Research with the Urban Indian Health Institute. And I am honored to carry my great-grandmother Ada Descanum's name, Tsitsiagwech, and present some shared knowledge with you today to help keep our relatives and our communities safe and healthy for 7 generations to come as we all struggle through these unusual and extraordinary times in a pandemic. You can hear me okay, right, Michaela?
Mm-hmm.
Great. So I first off want to acknowledge that we are going to have Jill Lapointe open us up in a good way, but I wanted to give you some background as to what this town hall is about and why we decided to hold it. We're the Urban Indian Health Institute, and we're a tribal epidemiology center, and a public health authority that serves a network of over 60 urban Indian organizations. And we also work closely with tribal communities in addressing public health and some of our more pressing needs for keeping our communities healthy and strong. And the purpose of this town hall is to share information and facts about new medications, treatments, and interventions that are emerging, address some of the misinformation that may be floating around out there in our communities, so that our people have that knowledge and that gift to be able to make informed decisions. And I just want to note that the Urban Indian Health Institute is not here to promote any particular treatments or medications. We literally just want to make sure that the right information gets to our people, and welcome any of your feedback on how to do that more effectively and efficiently across Indian country. And I think that's where I'll stop, and I'll have a chance to talk a little later with this wonderful panel that we'll be introducing soon after we open up in a good way.
Yeah, and I'm going to go ahead and say, to create a good environment for us today, we have asked for the traditional Indian medicine team here at UIHI to start us off with a blessing. So I'll go ahead and hand off to Jill.
Twa Golapu de Ishad, Jill Lapointe Zistas, Siskokwash Zistas, Tul Al Nuksat Gol Upper Skagit. Good morning, everyone. I just introduced myself in my Lushootseed language. I am a member of the Nooksack tribe and descendant from Upper Skagit. My name is Jill Lapointe, and the name that was given to me by my great-grandmother is Siskokwash. And I'm the granddaughter of the late Takshublu Vai Hilbert. So thank you for allowing me to be here to open this gathering with a blessing. Ha ha shaksiab, spud bulachi bi chash, utigwid zid chash, atika ad zapadab. As priya tia swaftivtad, dehwal tia ishad chash. Eti bug to yal yalab chash. Daet hash tia sas kol chash. Al tia sla chel. Otigwid chash. As shab tadabu chash. Otigwid chash. Twalti bug gol atzil tabu. Gohali chuh. Tilok lok chash. Guhalita chof. Tibad bada chash. Guhali taf chuf. Gul atzir tabiu. Abash chachbin. Tisiayus atahash. O tigwid chash. O tigwid chash. Globe assista.
Thank you so much, Jill, for that blessing. And we want to start out too by sharing with you all our agenda for today. So as you can see, we started out in a good way. We're going to next meet our panelists. We're going to ask them to share their experiences with COVID-19, talk about the differences between treatments and vaccines, and as well talk about current COVID-19 treatments that are available. As you can see, we're going to have a Q&A session at the end after we have our topics before we're closing in a good way again. So, and I also want to remind you all that this is a town hall. So we're looking for interaction from the audience. We want to make sure that you all are able to participate. And so to kind of facilitate that participation, we're going to start off with some ground rules. We want to thank you all for attending and make sure that we're operating in a good way. We want to make sure that everybody is in a respectful place for knowledge sharing. So that means that we want you to feel safe asking questions, sharing your stories. So we want to make sure that things like offensive speech, spreading false information or harassment, those are not acceptable in our community. And so, so you all know how to interact with our town hall. There's going to be two features that you can use in the chat for Zoom, or there's going to be two features you can use in Zoom. So the one on the right, on the bottom, is the chat feature, and that's for you all to share your thoughts, share your stories, you know, as we go into the discussion. The feature on the left is the Q&A feature, and so that's where you can put your questions for the panelists so that we can get those answered for you at the end during our Q&A portion. So if you are watching on Facebook Live, please leave your questions in the comments and we'll make sure to get to those as well. So now that you all know how to submit questions, please note that this information is just information that we want to make sure our community members have to better inform themselves, but this does not substitute professional medical advice. So keep that in mind. And without further ado, we want to introduce our panelists to you all. So first up, we have Dr. Rosalina James. Dr. James, as she said, she's our Director of Research and Evaluation over here at the Urban Indian Health Institute. And she supports UIHI in our commitment to decolonizing data and ensuring that our data is accurate and accessible for partners and providers, making sure that it's informed by Native people, as we know our own needs best. So go ahead and let Dr. Rose James introduce herself. Say hello.
Hi, Rose James, Tsitsiagwek. And I just want to say welcome to everybody. I've seen a partial list of participants and recognize some colleagues and old friends, and it's so wonderful to have you join us today. And I also want to emphasize that we are going to be keeping a tally of questions that we don't get to because this is a short period of time, and see if there are formats that we can find those responses and get you the information you need, even if it's outside of this venue. My background is a background in lab science, and I have a background also in doing a lot of bioethics research. What that is essentially working across researchers and American Indian, Alaska Native, indigenous communities to educate about ways that we can conduct research and inquiries with and for our communities that actually benefit our communities, even if not directly right now as participants in research, perhaps in the future for our children and our children's children. So that's part of my background, and now I've been working in public health as a director for evaluation and research with the Urban Indian Health Institute for several years. And just want to point out also that our Urban Indian Health Institute is a division of the Seattle Indian Health Board. Haishka.
Thank you, Rose. Our second panelist for today is Valerie Siegrist. Valerie is an enrolled member of the Muckleshoot tribe. She is a Native nutritionist and herbalist who serves as the regional director of the Native American Agriculture Fund. And her work is dedicated to Native nutrition and the efforts of the food sovereignty movement, rooted in education, awareness, and overcoming barriers to traditional foods for tribal communities. I'll go ahead and let Valerie introduce herself as well.
Hello, thanks for having me. It's such an honor to be here and be asked to share some perspectives on how what we're seeing in the community around COVID and people's interest in treatments and vaccines. My background is in nutrition. I've worked for over a decade now to develop culturally relevant curriculum that I feel has really helped tribal members feel more inspired and empowered to take care of themselves and incorporate traditional wellness practices into their everyday life and communal life. Thanks for having me.
Thank you so much. So our third panelist for today is Dr. David Wall, who's an infectious disease physician. And so during this pandemic, he is among those leading the University of North Carolina's response to COVID-19 pandemic. So he's actually the co-principal investigator on the Active 2 trial, which is mostly, it's all looking at COVID treatments. So I'll go ahead and let him introduce himself.
Thank you, Michaela. I'm David Wall, and I'm here in North Carolina and very deeply honored to be part of this meeting and hope that I could share some of what I've learned over the last year so folks can make good decisions for themselves and their families. So thank you.
Thank you all so much for being on our panel today. To kick us off, we first want to take the time to hear from all of you about your firsthand experiences with COVID-19. Please feel free to share, especially based on your different fields of study and communities. So we'll have Dr. James start us off.
Sure. I am very fortunate that I have not had immediate family intersections with this this deadly and virus that has transformed our lives. But I'll share something about my. We have had extensive COVID experiences within our extended relatives and families up at Lummi for sure. Prayers to you, all of my relatives, aunties and uncles and nieces and nephews, where an outbreak in the Whatcom County area is really, really taking foothold. And in our extensive family and relatives and network of American Indians, Alaska Natives all over the country where this has been a devastating pandemic. And that's the purpose of this particular town hall and discussion. My experience with COVID, I'll just say, you know, actually it's been transformative, like all of us have experienced as a public health authority. We never stopped going to work, even when Washington State, the COVID curtain came down and businesses were shuttered for a while, for months and months, and some of them, many of them, unfortunately, never reopened. We kept going into the office and we transformed how we provide care to our patients' relatives through the Seattle Indian Health Board Clinic, as well as how we conduct ourselves in the office. As you can see, Michaela and those in the office are wearing masks and social distancing. And it has been, it has turned our worlds upside down. And now we're just kind of figuring out where the new normal might be. My children, I've got two that have, one that's supposed to be in school in New York all year, but in March we got her home, and both of my children, one in high school, one is still taking online classes, New York time. It's been difficult to work from home, I'll tell you that. It's really hard to play this musical chairs of which room you can be in and how to set up your space, and dogs barking in the background. And so these are some of the more common things that every day, all of us, no matter who you are, have experienced. And I certainly have had friends who have succumbed to COVID disease, and it's through their spirits that I'm here today to talk to you about what we can do about that. Thank you.
And I'll go ahead and ask for Valerie Siegrist's experiences with COVID.
I I am a mother of a 6 and 7-year-old. And so first and foremost, that has been totally different to have a entering kindergartner and second grader. If you can imagine your first year of school being totally different, not getting that bus ride and all the things that, you know, my 6-year-old was really looking forward to. We just kind of had to grieve the loss of that and figure out how to not just work full time, because the food systems sector did not slow down either. I think we're very integral to public health. And my work at the Native American Agriculture Fund allows me to witness the work of community food projects all over the country. I'm directly helping to coordinate over 20 of them right now. And a lot of them are in the Southwest. And so when Navajo is getting hit really hard, my grantees were calling me about, driving sometimes 2 hours one way to find grocery shelves bare because of panic buying. It has been really, that part has been stressful. And then being a teacher at home, my background is in curriculum. So of course I wanted to get the best I could to my children and encourage them to be more active and outside, and also try to be a part of the solution for all the issues that education is facing. And then my partner is a tribal council member for our tribe, for Muckleshoot. And so I've watched him, not dial down at all as well, and have to make really tough decisions, especially during, he's very involved in our cultural and spiritual work here in this community, and having to socially distance when we probably need those things the most has been really difficult. Having to do funerals and grieving differently has been pretty difficult. And also graduating and celebrating, all that's different. And I think we're all just sort of grieving the loss of it. But on the other end of it, the thing that's really fueled me the most is watching how people mobilize, and how all these grassroots efforts, when the federal government was having a hard time getting feeding programs and things delivered to our tribal communities, it was these grassroots efforts that stepped up and had instant access to their community members. COVID sort of illuminated all the cracks of our food infrastructure. And so the wonderful people I work with at NAF and I sat down and wrote this, reimagining food economies report and pushed that out the door just to kind of think about how when we return to a new normal, what that actually looks like. And that's what I think interests me so much about this conversation, to be in the public health sector directly and talking about how we might, return to a different kind of normal, based on our lessons learned from this whole entire experience. And my brother and my sister-in-law got COVID, and they recovered. So we're still dealing with the aftermath and the side effects of that, which has been really interesting and kind of scary, honestly, to deal with. We have had to quarantine ourselves several times because we had been exposed, but none of us have, in my direct family, other than my brother, have had that positive test result. So it's been a stressful year. And I think for so many of us, we're thinking about, how do we recover from this? Or maybe that 2021 would have been a little bit of a relief. And I'm finding myself pretty fatigued, to be honest. I'm finding that it's going to take a while to stand back up again, and operate the way things were going pre-pandemic. So what does that look like? I think it's time to start really moving towards that, and that we have more elements in place that can help, encourage a healthier future now, because we've had this lesson to learn. So that's been my experience.
Thank you so much for sharing, Valerie. And we'd love to hear from yourself, Dr. Wall, and your experience with COVID-19.
Yeah, no, thank you. And thanks to Rose and Valerie for starting off, because it's not an easy thing to talk about. And I think for many of the folks who are here, who are not only dealing with this for the last year or more, as a mom, as a dad, as a son or daughter, but also as part of your work, part of your job is to deal with COVID-19, whether that be a nurse in an ICU, or a physician, or other types of healers. I do think that there's two different realities. There's the reality of my 16-year-old spending way too much time online, but then dealing with the whole issue of how do we help get out of this, and dealing with the sickness and the death that we're seeing. So in some ways, I feel I have it easier in that I haven't been home. I'm not stuck at home. I'm not bored. I haven't sat on my couch in a really long time. Whereas my family, they've been in the house most of the year. And so I get out and do things, but when I do get out and do things, I'm really busy thinking about patients and about how do we, have a COVID ward that's safe, that is staffed well. How do we set up testing for folks who work on farms that are 3 hours away from the nearest hospital or clinic? How do we make sure vaccines, now that they're out, get to the 83-year-old grandma who lives in a trailer and doesn't know how to download an app that she needs to use to get an appointment that could get her a vaccine that could save her life? So there's loads of things that are going on for me. And so it's a really difficult time, I think, for all of us. And I'm really just hopeful, especially over the last 3 to 4 weeks, that we are seeing some things turn the right way. The number of cases in the country have started to drop. I think people are getting the message that we've got to work together. to protect each other, and that if we can mask and distance and resist this urge to satisfy, these needs, like being, of course, we all want to gather. Of course, we all want to have dinner together. Of course, we want to go to a bar or restaurant or movie theater, but we can infect somebody if we get sick, and that person could die. People who die in the ICU got it from somewhere. So having that view, that perspective has really, I think, changes a lot for me. And when people ask me, I want to go on a trip to, ski, or I want to go to Florida, or I want, and, should I do it? I just have to think about those people in the ICU right this moment who are struggling for their lives, and just think that we have to honor them and that we're not out of this yet. So for me, it's wrapped up into a whole bunch of things of dealing with, but also trying to work really hard with many, many other people, including Rose and others, on getting us to a point where this is a memory and we talk about, remember what it was like during the pandemic.
Thank you all for sharing. We do want to take some time to talk to our audience and see what you are all thinking when you hear about COVID-19 treatments. In the beginning, we did have a link up in the chat. If you haven't already clicked on it and put your added in your answer to that question, go ahead and do that now. We're going to share it in our word cloud. Great. Awesome. So we're going to kind of ask our panelists, like, what are your feelings when you see this word cloud?
I'll just say, for one thing, the biggest word in there is need, and what we need to do is, as Native people, be messengers for what access we can get to treatments and vaccines, and be a voice at every table, raising our voices to make sure that our people are not overlooked.
Yeah, and anything from our other panelists, what comes to mind when you see these words from our community?
It is great to see that, the next biggest words are vaccines and end. And I do think that that's really helpful, because I do see the vaccinations as being a big part of us ending this. It's not the only part, as we'll talk about, but if we can get enough people vaccinated, it's going to make a tremendously huge difference for everybody. So I'm glad to see that, actually.
I echo what Dr. Wool and Dr. James have said today, that need vaccines, and those are all really valid words, and I think animate exactly what we're all, desiring these days. And that's really great that we're, we have to be, we have to find some common ground in issues that are really complicated and can polarize people really quickly. So I am excited to see these words in a weird, morbid way.
Yeah, and this is actually a great segue. This town hall is focused on COVID-19 treatments. We've been hearing so much about vaccines, and we want to be able to share with our community what treatments are available. And so we're going to kind of start out this next section a little bit focused on Dr. Wall, and what are the differences that you see between treatments and vaccines?
Yeah, it's a really important distinction. So, I think it's best to start out with thinking about when the virus infects somebody as being the line, and we can go to the left side of the line or the right side of the line, or be right on the line. So if we all imagine that line is when the virus enters somebody's body, let's talk about the left side before they got infected. Vaccines are really helpful in protecting people when they're effective and safe and people get them. They're really effective at helping somebody when that virus comes into their system, it basically gets ignored. The body knows how to handle it. The body gets rid of it, neutralizes it, whatever word you want to use, and that person doesn't become sick. Or even if they do become sick, they become much more mildly sick. So a great vaccine is one that makes you not quite bulletproof to the virus or to the infection, but close to it. And that's what we all hope for, right? We get the flu vaccine hoping that it works so well that if somebody sneezes on you, nothing happens to you. The virus may get into your system, but your body recognizes it right away and kicks it right out and eats it up. With the COVID-19 vaccine, we think that's likely to happen. What we do know right now is people who get the vaccines that are available right this moment, their risk of getting sick with COVID-19 is extremely low. In the studies that have been done, when you look at everyone who got COVID-19 in the study, right? So let's say, in a study of 40,000 people, if there's people who do get COVID-19, you find that 95% who got COVID-19 were in the placebo arm, the arm that didn't get the active vaccine. Very few people who got the active vaccine got sick with COVID-19. And the vast majority of people who got sick with COVID-19, well, they weren't they got the placebo, they weren't getting the actual vaccine. So that tells you a lot about the protective effect of the vaccine. So we know that they work to protect people from getting sick. We think, and it's looking more and more as we get more information, it also prevents people from catching the virus and then spreading the virus. So we'll find out more about that, I think, in the next few weeks, but it looks like that. Okay, so that's a vaccine. It prevents you, it protects you. It doesn't let you get the virus into your system so that you now have the virus replicating for days on end, hurting you and possibly shedding to others. On the right side of the line is what happens if that doesn't happen. Either you're one of the unlucky ones that the vaccine didn't protect, or you got infected soon after you got vaccinated, so the vaccine didn't have a chance to work, which is what happened to a lot of the folks in the vaccine trials. Or your immune system's really weak and you don't respond very well to vaccines, or the vaccine wasn't given to you in time because there's a scarcity of vaccine. There's millions of people who can't get the vaccine right now. And that's a problem. And that's something that you're hearing about every day. It's front and center. We all want more vaccines out there. And then, of course, we know that there's some people who are really, for very good reasons that we should acknowledge, skeptical, hesitant, cautious about taking vaccines in general, and maybe even more so for the COVID-19 vaccines. They were developed quickly. I can say they were developed rigorously at really incredibly fast pace, but being involved in this, and I could tell you that we just like anything, we just did everything we normally do. We just didn't waste any time and we didn't sleep on it. We just kept going. So I think the processes have been fantastic. I think they're rigorous. I think the vaccine research is solid, but I understand, especially among peoples who've been exploited and abused and lied to and experimented on, why there could be skepticism. And when our federal government at the time is not consistent in its messaging and creating more confusion for political reasons, it really does make people wonder. So I hope that's changing as we see more people get vaccinated and get protected, as we see more data come out from really good studies from all over the world, that people will feel more comfortable about making a decision about the vaccine. And my hope personally is that they'll decide to take it. But people get infected one way or the other, and some of them become sick. That's where treatment comes in. Because right now, for most people, if you call your doctor and you say, I just got diagnosed with COVID-19, I lost my smell and I'm coughing a lot. And I could get around, I could walk up the stairs. It's a little harder than normal, but it's definitely not feeling good. She's gonna tell you to stay home. She's gonna tell you to take some Tylenol and drink a lot of fluids. We don't have a whole lot of options for treatment right now because we don't have a lot of treatments. And as we'll talk about, I'm sure, there are some treatments that are available that are infused, where you get hooked up to an IV and get an infusion, but they're very underutilized and you have to find them. And there's not great on-ramps to that. We need better therapies. We need something that your doctor can call into a pharmacy or that you could pick up and get that can knock this thing out really quickly. We have that with antibiotics. You get strep throat, you can get an antibiotic that will knock it out within hours to a day. We don't have that for COVID-19. And just imagine if we did, if we had vaccines, and that protects so many people, but for those who break through and get sick, we could have a treatment that keeps people from getting sicker and ending up in the hospital. And so that's really the whole idea. It's a 1-2 punch that I think is really necessary. The last thing I'll say, and then I'll be quiet, is that there's also people who are just on that line. There's some people who get exposed to the virus, like in a nursing home, right? Or maybe a prison or jail, or in a household where somebody gets it first, and then everyone has been exposed, but we don't know who's going to get sick and who's not. There's even some work that shows you can give treatment to those people, a one-time treatment, and it reduces their risk of coming down with COVID-19. So that's sort of right there in between. You know, I'm not yet sick. I may have the virus, I may not, but it's almost like preemptive or prophylactic. Like, I'm going to take this because I got exposed. This is going to prevent me from getting sick in case that virus tries to make a house inside my home. So that's just something to think about.
Thank you so much for illuminating that difference for us. On our next section, we're going to focus a lot more on COVID-19 and open up to the entire panel. We'll start by asking Dr. James, what do you believe there are barriers that exist for our Native community for seeking COVID-19 treatment?
We've talked about a few of them, certainly, and I'll go into a little more some examples of what has fueled a lot of the historical distrust of research, of researchers, of federal agencies doing research with our communities in the name of the larger good for society, for the population at large, in some cases, actual harm that's been done to our communities through exploitation and worse. But first, I want to say that one of the biggest barriers right now, I'm finding, and this is not something I have a whole lot of data on right now, is that people just aren't even aware treatments exist or what they are. All of the discussion right now is around vaccines. That Dr. Wall did such a wonderful job of describing the difference between treatments and interventions like treatments that are and vaccines. And sometimes they can work together to prevent or just prevent the COVID from taking hold in people who get infected, or to actually just mitigate the outcomes so we don't end up, our aunties and uncles and our children don't end up on ventilators or with some long-term health effects, like a friend of mine who still is having problems months later after recovering from COVID. So I think awareness is important, and we want to tap into all of you out there in the audience to help us, you know, move forward this information in a way that speaks to our people. I want to put a shout out for our staff that introduced themselves earlier, and a number of them are behind the scenes right now, but they've been working really hard to create resources, not just around treatments, which we're just starting to populate our link on our website, which we'll share in a little bit, but also around vaccines. So people have that information in ways that is meaningful to them. And also discussions. We have a short video series of native to native professionals talking about clinical trials. What are they? What's it like? What can we do and not do? And what should we be concerned about? What kinds of questions should we be asking? And that's what we're trying to compile for our communities that are federally recognized tribal community members living on reservations, or urban Indians residing anywhere in the country. Because like our relatives, public health doesn't stop at our borders. And we need to reach our people wherever they are. So awareness is the big one. Distrust, participating in clinical trials. So Dr. Wall will talk a bit more about some of the trials that are going on around treatments. But I want to take a step back and acknowledge that we have a communal memory, meaning our relatives told us the stories of the kinds of research malpractice in many cases has occurred in our communities. And we have a good reason to mistrust outside people from universities and from the federal agencies like the National Institutes of Health coming to our lands and saying, we would like you to participate because this will be good for you. It will be good for your family and your communities. So just some basic, just a few handful of examples. Even theoretically trusted medical institutions have developed a historical reputation for violating that trust with our communities. The Indian Health Service, which actually was an agency that was formed out of the war to protect soldiers, non-native soldiers, from some of the diseases and things that were occurring in tribal communities. They in the 70s and even beyond, I've heard, had a process for forced sterilization of Native American women, and we can't forget that this has occurred in our histories and our relationships with the federal government. This isn't just like a century ago. This is up to the 70s and potentially beyond. So this is recent that we have reason to question the intentions of investigations that are supposed to benefit our communities and not harm us. The women that were between 15 and 44 years old were sterilized, or hysterectomies in multiple types of ways without informed consent. And it was to address the high birth rates and the young mothers and those public health seeming issues that drove that research. That it wasn't even really research, it was just medical procedures. So we need to acknowledge that. There's radioactive iodine testing in Alaska Natives in the late 50s to see what the role of the thyroid was in cold acclimation. Of course, lack of true informed consent was part of that process, and there really was no direct benefit to the Alaska Native participants in that particular study. The Havasupai and Nch'Tenoth First Nations experiences with research you may have heard of, and this is a situation where the tribe and First Nations communities worked with genetics researchers to look at important health issues in their communities through genetics research. And in addition to that work that they had agreed to do and approve through their councils and other formats of research review, the research team did to look at other things without the approval or knowledge of the tribe or the First Nations community. In some cases, like the Havasupai case, they actually rallied across Indian country, and those samples that were taken, samples being blood and tissue samples, parts of the body that were taken were returned to the Havasupai tribe so that they could treat them as they should and as they believed they needed to carry on their spirits in the new world. So those are some examples. Distrust, there's also cost, and I'm going to let Dr. Wall talk a little bit about that, because we are always concerned about whether we will have to support any kind of unexpected medical bills. Will the Indian Health Service, those clinics that are receiving care through Indian Health Service, be providing treatments and making them available, and how much of that will be covered? So I'll let you talk about that, Dr. Wall. But I also want to point out there are other logistics things. These treatments that are becoming available at the moment are not available everywhere at your local clinic, for example, down the street, and in some cases, many cases in Indian country, the local clinic may not be, maybe miles and miles away. So transportation can be an issue, just things like those logistics. I think we really need to do more work to gather data on and information from Indian country around what kinds of barriers exist, but those are some examples.
Yeah, so thank you. I think so. People have heard us talk about treatment and maybe wondering, well, okay, I know about the vaccines. There's the Moderna and the Pfizer vaccine. I got that, and I've heard about that. There's websites on where to get it. And I think people are pretty clued in. So what are we talking about with treatment? So believe it or not, and again, I have a feeling that a lot of folks don't know about this. There are treatments for COVID-19 and people with risk factors for severe disease. So what does that mean? So people who are 65 and above, people who have diabetes, people who are obese, people have immunocompromising conditions or lung conditions or heart disease. So a lot of folks. And those folks are eligible for getting a treatment called a monoclonal antibody. And so this is medicine that the FDA has said, given the potential benefits and what we know about the risks, we think that this should be available on an urgent, emergent basis. And this is what, when former President Trump got sick, his doctors knew exactly what to do. They got him this stuff and they gave him an infusion right there and then through an IV, a one-time infusion of this monoclonal antibody. So what does that mean? What is it? So when somebody gets infected with COVID-19, just like with anything, your body knows it and responds. It says, that doesn't look like me. If it doesn't look like me, I'm going to get rid of it. And so your body has a few different ways of doing it. But one of the first ways it does it is it makes antibodies against something. And an antibody is like a Y-shaped missile. So it almost looks like a slingshot, but the pointy parts, the two pointy prongs, attach to the germ. And that could stop it from doing whatever the germ wants to do, because now it's coated with all these little antibodies. And so functionally, it can't enter a cell or replicate or do anything else. The other thing is those antibodies on top of a virus or a bacteria, it's like sugar coating for other cells that come along and gobble it up, like Pac-Man. Remember Pac-Man? So it looks at it and says, okay, that's covered with antibodies. That looks yummy. I'm going to swallow that sucker up and I'm going to digest it and get rid of it. So you have two arms of your immune system that do that, the antibodies and then the cells. Well, unfortunately, the antibodies take a little bit of time to develop the first time you see a germ. Your body just has never seen this before. It's got to get geared up. The problem is that can take as long as 2 weeks. And so if you're really good at making antibodies, awesome. Within a few days, you might have antibodies to attack the COVID-19 and the virus and stop it from doing stuff. But there's that lag time and stuff can happen during that week or two. And the virus just has its way. It can enter into your cells. It starts to damage the cells in your lungs. And before you know it, your body's trying now to fight back, and it's a losing battle. And now your body is making the things worse because it's destroying cells that are infected because things have gotten out of control. And before long, you're all swollen with fluid in your lungs, and your lungs are inflamed, and then people don't feel well and they get really sick. So if you could jumpstart the process by giving antibodies, the idea is, can we forestall that progression? There's two types of ways we think about antibodies. Like, what if we got a donation from somebody who survived COVID-19 and donated their blood plasma, which has all the antibodies, and that's being studied, and that's kind of interesting. But your body may have made good antibodies, or it may have made not so good antibodies. Maybe they work really well, maybe they don't. So it's a little bit of a rolling of the dice when you get plasma from a person. There have been people who survived COVID-19 who their antibodies have been looked at in a lab, and some people have like kick-ass antibodies. Like, they really work at neutralizing the virus. And it's not everyone, but it's a good amount of people. And you can copy those, just like in a copy machine. We're not taking this person's cells, we're not taking their DNA, we're just making we're basically constructing from scratch antibodies based upon the blueprint that we get from people who survived. And that's what these monoclonal, mono means one, clonal means copies and copies, copies, and antibodies. So we're taking one pure copy of an antibody that works really, really well, and we're giving it to people so that immediately, within minutes to hours, those antibodies are circulating and attaching to the virus and giving you days of a jump start in fighting the virus. Okay, so that's the whole idea. Antibodies can't be swallowed. If anyone takes insulin, you know that. Proteins, because they're proteins, and protein gets digested in your digestive tract. That's what we're supposed to do, eat proteins. So you got to bypass that by putting it in the vein. So it's an IV that goes into your vein. It gets infused, just like if you got some fluids, if you've ever been dehydrated, and it goes in. And nowadays it's like 15, 20, 30 minutes. It goes in, and it's one-time deal. You're done. So that's what we're talking about. That's available right now, not in a study. Anyone could get that who qualifies based upon being high risk. If you're 23 years old and you're healthy as a horse and you don't smoke, there's nothing going on with you, you can't get this because your risk of progressing to severe COVID is really low. But if you have any of those risk factors I talked about, you can qualify. The trick is to find where is that. And so you who are leaders in your community, who have roles of responsibility, may have to help with this and find out, well, where do I find the monoclonal antibodies? Maybe I got to look it up on, talk to my health providers, talk to my health systems. Can we get a list together? Can we get this on a website? Can we find out? Can we share word so that if anyone is in this situation, because the last thing I'll say about this is the longer you wait, the less effective this is. In the studies that have been done, couple of things. One is this has been studied in thousands of people. What we're finding is the earlier you give it, the better. And it keeps people out of the hospital. And so far in every single study, and there's numerous studies now, several thousand people who've gotten a monoclonal antibody of one type or another, nobody has died from COVID-19. That's not the case in the arm of the placebo group in these studies where there have been deaths. So that's pretty striking. Safety looks really good too. So we're not seeing people who have any side effects other than what you'd expect when you mess with putting a protein in someone's vein, which is like, whoa, I'm feeling a little flushed, or I'm feeling a little, you slow it down. Some people can get like a little bit of an allergy, just like anything else, but by and large, incredibly safe. So at my hospital system here, we've done 1,600 infusions over the last 2 months, and it's gone very smoothly. So it's something that's out there that people don't know about. And I worry that people don't know about it, but it could prevent them from getting really sick and even getting into the hospital.
Thank you so much for sharing. I want to ask Valerie specifically, as Native people, we do have our traditional medicines, our plant medicines. And so what would you say to somebody in our community who asked if you can cure COVID-19 with just using traditional medicine?
Because I have amazing public health mentors like Dr. James and and believe in research so deeply, because this is so new, I would say that we just don't know if our traditional medicines would heal or cure COVID, but they are an important leg of how this, approach to keeping us healthy and safe. We know that our traditional medicines are powerful, and they are antibacterials and antivirals, and and they support our immunity. They, help keep our insides working properly so that we can absorb good nutrition. They help assist us in building our immune system, which is like an internal Department of Defense, So right now, more than ever, we need to be embracing, why not, right? Embracing more of our traditional medicines. We have a pot of cedar leaf or any kind of conifer needle just sort of simmering on the stove at all times in my house to help clear the air and clean up any kind of bacteria in the air. We're drinking lots of lemon balm tea because it's antiviral and available even during the winter season here in Washington. You can just go outside and trip over it. If you have it in your garden, it never goes away, and you can buy it at any grocery store in a tea box. And it's safe for kids, and it's also really great for ADD. So for those of you who have kids at home, we need to focus on school. It's a great alternative. Every day we've been making sure to take extra vitamin C. We're eating lots of rosehip jam because that's really high in vitamin C and iron and phosphorus, things that purify and clean our blood. So we just got to take really good care of ourselves, utilizing those traditional medicines and foods to be able to, stand up to this and not. I feel, once again, it's this really complicated issue. And when we oversimplify it by just using one answer, then we create polarizing effects. And so we've got to figure out how to utilize all of the best of these innovations that are coming at us. Our ancestors have always been that way. They've always looked at the best of what's available at the time and how it would serve us in something like this and keeping us safe and healthy. And so I believe more in functional medicine, that if we have a great working immune system and you're exposed to the virus, you will have a better chance at not suffering such long effects. And we do know that with some things like elderberry or cedar leaf, that they help us fight those viruses and bacterias. But we just don't know enough about specifically the interaction between this virus and our traditional medicines. But don't write them off, use them.
Yeah, can I say one thing after that, Val? That was just wonderful. I want us to remember that our ancestors, our people, have always been scientists and researchers and experimenters. That's why we have traditional medicines and plants and foods today that boost our immune systems and historically have made our people strong. But we also, as a people, have been practical. When a new tool comes along, we consider whether it's useful in our toolbox for what we need to do, for the work that we need to do. And just because we can weave a basket water tight so it holds water and it can boil clams and have other important purposes, when somebody came along and wanted to trade a steel pot, we didn't throw that out. That's a tool that we continue to use today. It does not replace the weaving and the importance of that cultural value that practice had so many purposes for, in making our communities strong and our people strong for generations. But we've always used tools if they're the right tool for the job. And in this extraordinary time, there are new tools coming out that we need to take a look at and decide if they're the right ones for us in these communities. And participating in research, I'll let us go to the next question soon in a minute, but participating in research is something that I know I just discussed is something that is there's a lot of mistrust of the institutions that are putting on this research, but at the same time, with these new tools coming out, these new medicines, treatments, interventions, and vaccines, we don't know how well they'll work in our communities and with our people. There is no guarantee that everything is going to go perfectly, that there won't be any side effects or anything like that. That is what experimentation and research is about. But I do know that we will have no evidence of them being safe and effective with American Indian, Alaska Native people if we don't have any participation from our communities.
Thank you all for sharing. We're going to go ahead and move on to our Q&A session. As you all can see, there's tons of questions for our panel, and that's why we decided to make this into a series. So we have some questions from our audience. And so the first question would be for Dr. Wall, and what would you say to people who are concerned about the side effects for treatments?
Yeah, I think we should always be concerned about side effects of anything we put into our bodies. And I'm sure Dr. Siegrist would agree that, no matter where it comes from, there's plants that can make us sick. And we know over time through trial and error and passing down wisdom, which ones to eat and which ones to tell our kids not to put in their mouths. And so the same thing happens with medicines, and different people react differently to medicines. You may know that there's some that you could take, no problem, but that I can't take because I might get a rash or an allergic reaction that's more serious. So the good news is that so far, at least these monoclonal antibodies, and they're just the beginning. We're working on, can we find better things, easier things? But even these monoclonal antibodies, they look really good because your body's used to dealing with antibodies. It's not a huge deal, and it gets rid of them just naturally over time because it too is considered to be kind of different than you. And so eventually your body just gets rid of them too, but they give you that jump start I talked about. The problem really is, and this is everything that, like in medicine and everything with COVID-19, it's like, do I go to Walmart because I need to get some groceries, but I know that there's some risk. And the last time I went there, not everyone was wearing a mask. And if I go at this time of day, it's more risky than if I go at a different time. We're always making risk benefit analyses now that we're in COVID time, right? I've noticed that constantly. Everything comes down to, is it worth the risk? Is the benefit worth the risk? And the problem right now is that the risk of COVID is really high. And the risk for many of us, now if you're a 10-year-old, the risk is different than if you're a 60-year-old or an 80-year-old. But the risk of COVID making you really sick is not negligible. So I balance the risks in my community of getting exposed to the virus. My risk, if I get exposed to the virus, will I get deathly ill or not? Is that likely or very, very unlikely? And then what's the risk of the intervention, whether it be the vaccine or treatment, right? Those are the things we have to balance, right? And so that's why it's very helpful to think about, well, food is good because I know food I can tolerate. And food comes with zero risk, right? And there's some tried and true medications, natural medicines, medicines you can buy in a pharmacy, medicines that are prescribed to you, tried and true, that you can take. But then there's these newer things. And so we just have to think about it on balance. The risk of COVID, the risk of getting really sick with COVID is very real for a lot of people. And so I understand the side effect thing, but for me, working in a pandemic where people are dying in large numbers, where 1 out of 1,000, at least Americans, have died from this infection, my threshold for being too concerned about side effects has gone down, has really gone up. My threshold is high. That said, so far the side effects look really good. And so if it was me, I got vaccinated. If I got sick, I would want a monoclonal antibody. Same thing for my kids.
Thank you so much. We have another question for Dr. James. Why is Native participation necessary in clinical trials for the development of COVID-19 treatments?
What a great question. I do know that we have not traditionally participated as a population in clinical trials in the past. In clinical trials up to this point largely have been representative of Caucasian, non-Native, non-African American, a lot of women and men, but a lot of women seem to sign up and participate in clinical trials. And as such, the measurements that are done within the trial that show whether it's safe or effective are reflective of the population that participated in that trial. So a lot of the medicines that you're getting over the counter or you're getting prescriptions from when you go to the clinic are medicines that went through some sort of clinical trial. And sometimes we find that our family relatives, my father is one example, he had a really bad reaction to a new medication for his diabetes. This was quite a while ago. And it was really scary. Why did that happen? Would it have been different if we had more people like him from American Indian, Northwest tribal communities, etc., North America, and Alaska Natives that participated in the trial that deemed that particular medication safe and effective? Would it have been safer for him to have tried that medicine without actually feeling dizzy and fainting, basically? So if you know anybody or you yourself have ever had an adverse reaction, that's what that is, adverse reaction, they call it, to a medication, it could in part be because the population that the clinical trials tested the medication on did not reflect our own population and communities. And it's in clinical trials, what they aim to do is actually be there and be paying attention and monitoring whether any adverse effect is having. So you're in an environment where everybody's paying attention to ensure that if something does look wrong or wonky, that you can voluntarily leave that trial, or they may shut down the trial. So those are my responses, is that for our relatives, for our children and our children's children, sometimes it may be really important to consider, will my participation be the gift to them so that it's safe and effective for them?
Thank you so much. For Valerie, what traditional medicine resources are available that you know of that we can help with COVID-19?
I actually put a link to it in the chat box. And if you go to the resources page right next to that, the main page right next to that herbal guide is one on wild spring greens, which is happening now. And then a decolonizing diets one as well. And all of those are just this sort of, nutritional approach to maintaining our immune systems and keeping our bodies really healthy and strong so we have stamina. So those resources are out there. And I'm also a part of a functional medicine website. I'll find the link and put it in the chat box as well for everyone, that just sort of puts out, what approaches are happening globally. If you've been exposed, to go home and open your windows and disinfect and drink lots of water, so there's lots of new advice that's coming out. I'd encourage everyone to, if you're in the Northwest, increase your vitamin D intake. I'm not into supplements. It's not a big thing for me, but I know we need a lot of vitamin D, more probiotics and prebiotics in our life, whether it be kimchi, sauerkraut, kombucha situation, or more yogurt. That that good bacteria balance in your body will also help build stamina, and keep your digestive fire alive. And I'm drinking lots of nourishing teas, if that helps too. If just getting some nettle leaf and having a nettle leaf infusion once a day, um, or lemon in my water, and just lots and lots of water so that your body can stay really well and hydrated and slippery inside, so things don't want to stick there and make a home inside of you. So but there's lots of great advice. I'd also caution that with social media and over sensationalizing everything, to be really, don't just read a headline and interpret. Make sure you spend time thinking about what they're telling you, because I see bits of truth partnered with lots of lies and chaos, and then this is creating lots of confusion in our communities. And so I spend a lot of time, sort of sifting through those articles that some of my community members send me, thinking, this isn't true. What they're saying is not always true. So be cautious with the advice that you are being given. What these guides that we put up on the UIHI sites have been reviewed by medical communities and clinical herbalists that are part of our network. And we're all, taking the same approach of just treating ourselves antibacterially, antivirals, decongestants, expectorants, immune support. It's all in the guide. So I hope that's helpful.
Thank you for sharing. We do have a question in the chat for Dr. Wall, and it's about, so would you agree that the reason we got the vaccine, and I would think treatments as well, so quickly, because we had the research infrastructure in place with HIV?
Yeah, that's I think in journalism they call that a softball question. So that's a good question for me. Yeah, so HIV research is a really good example, I think, and one of the really, I think, shining examples of community and clinicians and researchers of all stripes coming together to tackle a really wicked problem. HIV is a pandemic too. It's a horrible pandemic. It's just lasted a really long time. It's a very different type of virus, but it came from an animal. It jumped to people in one part of the world and spread all over, such as wherever there's people, there's HIV. And like COVID-19, over time, it found those who were vulnerable. It took advantage of social unrest, of racism, of sexism, of power imbalances, war, poverty. All these forces helped propel stigma, discrimination, all propelled HIV. And so it's killed millions and millions of people, often young people. It, eliminated generations of innovators, discoverers, entrepreneurs, and has left a hole in our world for the last 40 years. But we have fought back with the tools we had on hand early on being insufficient over time, through really coming together. And what we have now is a very robust infrastructure, research, and beyond research, how to take research and craft it and mold it so that it reflects the priorities of the community with their fingerprints all over it, and then is translated back into the communities to make a difference. And so with that, we don't have a vaccine, because it's a really tough thing to make a vaccine for, but we have medicines that if you take, prevents you from getting HIV infected, even if you don't use a condom, even if you don't use a clean needle. We have medicines now that when people take them can keep people alive for decades, approximating their life expectancy to that of somebody who doesn't have HIV. So it's just been, we have medicines now that absolutely almost 100% prevent a woman from giving the virus to her baby. And that's becoming available more and more and more and more all over the world. So there's so many lessons we could learn here. That infrastructure is what's been used to, there were no COVID doctors or COVID researchers a year ago, but a lot of people who now call themselves COVID doctors, or someone else would call them a COVID doctor, like me, I was an HIV doctor and an HIV researcher. Those same tools can be used in lots of different places. And that's what helped me when I went to West Africa during the Ebola outbreak. And we looked at ways to help people who are surviving Ebola and how to figure out more about their lives, about the stigma they were facing, about could they transmit the virus to their sexual partners. We used all the tools that we developed with HIV. So I think it's a really unfortunate but fortunate thing that we have in place that's really helped us with COVID-19 as well.
Thank you so much. We are going to run out of time if we keep asking questions, but just stay tuned, everyone. We will have another series, another town hall in our series, so we can get those questions answered. As we near the end of our time today, we want to make sure that we share some resources with our audience. Valerie and our Sam have already shared in the chat some links to our website. We also want to share the website for the Active2 clinical trial website to look at. It has resources to answer questions you have about available treatments, available clinical trials, and a map of where they are. Just a great resource to read up some more. And at the end of this town hall, we will be sending out an email containing links to all of these resources that you can share with your friends, with your family, and with your community. To end out our town hall, we will once again ask for our traditional Indian medicine team to close us out with prayer. And so I'm going to hand that off to Lorna right now.
My name is Laurence Kotemkin. Can you hear me? Okay. My name is Laurence Kotemkin. I'm from the Kawa Confederated Tribes. I'm a member of the Arrow Lakes and Sampoyel. We're people of the Coyote. Sinclair brought the Columbia River and the salmon. That's how we came to be as a people. I'm here today to offer a blessing for all of you and for all who have participated and are listening. Quillen, I give thanks to you on this day for this gathering provided for our nations. I give thanks and beholdingly give love and good medicine and prayers to these people on the panel that where they've been, that it brought us to today, so that we'll always remember where we're going for the next 7 generations. I ask that you watch and bless and take care of each and every person who's involved in this gathering, spiritually, mentally, emotionally, and that we remember to say and speak to our medicines, to our elders, to our ancient ones, all those before us that practice here today, that knew what we would need. I give thanks to all of our ancient ones who are here with us presently, for they're here and they're guiding us and guarding us, and that we never feel like we're alone, because if we feel that way, we're alone by choice. I ask that you take each and every one of these families and people who are nations, intertribally, all of the providers here, that provided this information in this time in the best possible way. That you look at them, that they have brought us the light. They're bringing us into the light. They're bringing us out of a place of uncertainty and fear. And that it takes that warrior spirit, that never-ending spirit, and that we continue to love and pray for them and their families, especially their children, who share them with us and share these providers, so that they can also take care of the communities of the nations, that we feed that spirit, and we give thanks to them each and every time, that we don't step over them or step on them, that we always acknowledge them, that we always remember their names, that we always remember what they have done for us here in this time for all the days to come. I ask that we continuously look at our medicines from our homelands, from our elders, both on both sides, the Western medicine and the medicine of our people, because it is so powerful, that we never forget these medicines, how to gather, when to gather. And I give thanks to science and the scientists and whatever it took for us to come into the light again, that we remember where we've been. And as Indigenous people and all people in all tribes, all nations, that we've been in pandemic probably since the time we were born. As spoken of AIDS, I remember when that came to our people, and the fear and the tear and the way that the world treated this, and that we learn from that, and that we embrace it, that we are prayed here, that we are loved here, that the words that are spoken today travel where they need to go, that what we hear, that we're able to continue to share with all of those from the left and the right of us, so that we can help lift that fear or animosity or history or generational trauma. And I ask continuously, again, Kulin Chutin, that you look on the healing places and all of our frontline people, our warriors who are out on the front line, that are testing all of the nations, that you touch their lives, that we never forget them and we thank them in some way. In our way of our people, we feed them. We give them water. We always remember them in our prayers. You look at our doctors, our nurses, all of the people that make these medicines available to the community, all the hard work. It's tired. They're tired. And yet they keep getting up every day and coming and giving the best to our people. And I'm thankful for them and their families. And I ask that you give them some light themselves in the best possible way, that we, to the left and right of them, remember them always, that this team of people that have brought this information in this gathering, that we remember them always, that we do not forget their names. I give thanks for this day. I give thanks for being here on the Sailor Seas. I give thanks for the swimmers, the flyers, the crawlers, and the forelegs. For all the days to come, we are stewards of the earth. We come from the earth, we go back to the earth. And I ask that we all that have gathered here today, that we feel that light, that warmth from all the work that has gone into getting us where we are today, for all the days to come. Lem lem. Thank you.
Thank you so much, Lorna. To everyone who attended today, thank you so much. Thank you to our panelists. If you are still here, please take our short survey so that you can give us feedback on how we can improve our events in the future. We are going to make sure to send you out our email with our links to the recording of this town hall, to some resources that we've developed to share with you all, including like clinical things about the monoclonal antibodies and fact sheet about clinical trials. So be on the lookout for that email and for the publishing of this video on our website. Thank you all very much for being a part of our panel today, for being our participants, and I hope you all have a great day.
And that.
Thank you.
Bye, Shka. Bye.
Have a good day.
You too. Thank you, Val.